I'm Dr. Rosalynn Austin, and welcome to Researcher Revealed. On today's episode, I'm going to take you along to the conference put on by the Association of Cardiovascular Nursing and Allied Professionals. If you watch this video on YouTube, you'll also get a few glimpses at the European Heart House and a few highlights of what it was like to be at the conference. But mainly, this episode is about the people that I met and the people that I spoke to. I am going to share with you 4 short conversations with different people who were presenting at the conference, from advanced clinical practitioners all the way up to senior professors. Tell us who you are, what you do for a job, and where you're from.
So I'm Mairead Lehane. I'm an advanced nurse practitioner in Ireland, in Cork University Hospital and Integrated Care. And I work with heart failure patients, and I'm leading out one of the finest cardiovascular integrated care teams in Ireland. Woohoo, Cork!
So you're here at ACNAP. Can you tell me a little bit about why you're here?
Well, you'll usually find me in ACNAP every year, but in 2025 I'm presenting 2 posters.
Woo! Congratulations!
So
Before we get into what your posters were about, how was that? Because, I mean, you introduced yourself as a heart failure specialist, so I'm guessing you're not really much into research. So how was it as a first timer presenting a poster at like this big conference?
Well, it's not my first time presenting it,
Oh.
but it was, it was good.
Sorry, I thought you said it was your first
No,
time.
did I say? No, for 2025. But it's a lovely opportunity to collaborate and share with people, because you're usually standing beside other people that are producing similar pieces of work, so you get different cultural perspectives and different kind of thought processes, and you kind of run back to the ranch and you kind of apply that to your own personal context and kind of refine it a little bit more.
Nice, I like it. So I'm going to give you a challenge. I mean, this is not your poster.
No, it's
Let's
not.
just be clear about
But
that.
it's one of the chest
is
pain
a poster.
giants of Ireland, yeah. I'm
It
very
is-
proud to stand beside
It
it.
is from the Irish Mafia, but it's
Yeah.
not your poster. Very, very quickly, in 1 minute, pick one of your 2 posters, your favorite one. Tell us a little bit about what you presented.
So I presented the development of the Upbeat program. That's a theory-driven intervention that was looking at heart failure patients from a healthy aging perspective and from a cognition perspective. So this was tailored to heart failure patients, particularly with heart failure with preserved ejection fraction.
Ooh, I didn't realize that.
Because they are the forgotten heart failures of
They are.
Ireland. They're not always enrolled in heart failure clinics. So this designed a program with a start and a finish that optimised their medications, educated them, and included aspects like advanced care planning, and it also took cognition into account. We knocked pieces of information down into a bingo game. So falls prevention, for instance, had 24 tiles. So it kind of was cognizant of cognitive load for patients. Had a 2-tier messaging system, one for the caregivers, one for the more cognitively impaired. And it was something that we're hoping to incorporate into a frailty heart failure type program. So we're developing that at the moment.
Oh, that's amazing. That sounds so cool. For everybody who's watching this or listening to it, in the episode description, I will put a link to your ESC poster and abstract so people can check it out. Also follow her on social media, all of that sort of stuff. One last quick question before I'm going to run to the AI session. I'm not where you headed. Oh, you're headed upstairs to the sex one.
Sexual counselling, yeah.
Perfect.
Also not very well discussed either,
Also?
dying
Also?
in sex and HIF-PEF.
Well, why would we
They're the Cinderellas.
They're the Cinderellas of the heart failure world. Really, really quickly, what would your advice be to somebody who might be listening to this or watching this, who's like, oh, this isn't for me? What would you say to them?
I think you have to start somewhere, and I think presenting your work and being proud of your work is a good starting point, because it helps you to refine it and to develop it into a bigger piece of work, or extend it onto something different that you didn't envisage all by yourself. So come to ACNAP.
Perfect. Thank you so much. Angela. Thank you so much for being willing to have a quick 5-minute conversation with me during this very busy and very exciting conference. Can you just say hello to everybody? Tell us who you are and why you're here at ACNAP.
Hi, so I'm Angela Massouh. I'm from Lebanon. I'm an assistant professor at the American University of Beirut, and I come to ACNAP. This is my 5th year. I present my research here, and I connect and meet people and get to know about the latest updates in cardiology.
Oh, that's amazing. Does that mean you were in Edinburgh?
Yes.
Oh, we missed each other then. Oh, I'm so glad to finally meet you. So very, very quickly, the research that you're presenting today, I'm betting they've been a little bit more generous than I'm about to be. In 1 minute, can you tell us about your research that you're presenting here?
Yes. So my research is around self-care and the diet. So I work a lot with patients and their caregivers. And the research I'm presenting today is going to be about caregiver burnout. So we measured burnout in informal caregivers of patients living with chronic diseases, particularly cardiovascular diseases, using the Massouh burnout inventory. And we were able to find out that in Lebanon we have like a moderate emotional exhaustion, some depersonalization, and a positive sense of accomplishment. But we were also able to find out that we have very poor quality of life in our caregivers. They are doing more than 40 hours per week of informal caregiving, which is equivalent to a full-time job. So it is very taxing on caregivers, and I think this is a proportion of the population that we are not giving them as much importance in the healthcare system as we should be. So our recommendations is to actually integrate them into the healthcare system because they are our liaison outside the hospital.
That is so interesting. I'm pretty sure I've bookmarked your talk as well from a very vague memory. So I'm going to double check, and if it's not bookmarked, I'm going to definitely bookmark it, because burden in people's health is something that's really important to me. So if I'm not, I'll definitely be there. Excellent. Thank you so much for sharing a bit more about your research. Very, very quickly, why is it that you think coming here to ACNAP as a nurse is such an important thing?
I think in the Middle East, where I come from, there are little research in nursing particularly, and I always find it better to connect with European colleagues, to network and to have mentorship from here. So I'm also in the mentorship program, and I have been MNT myself, and it has improved my career more than I can imagine. So that's why I like to come back here and reconnect with the people I already know.
Oh, that's amazing. Thank you so much for your time. I'm going to let you run away now. I have a presentation as well, so I need to run. But it was great getting to connect to you. So I'll see you later. Bye. Next, I'm here with Andreas from Germany. Can you tell everybody out there who you are, what you do, and why you're here at ACNAP?
Well, I'm Andreas. I work as an advanced practice nurse in Germany, in Frankfurt. It's exciting for me that I work normally there with heart failure patients in the cardiomyopathy clinic, but also on the wards. So it's a slightly different role.
Okay, very cool. And what brought you to ACNAP this year?
So 2 exciting things is for me on the agenda.
Okay.
I find it's 2, because once I present the German Society of Cardiology, and I'm trying to get as much input as possible to get back what we can learn and bring in.
Okay.
And the second thing is I always love how ACNAP actually has up-to-date knowledge, what we can use in practice, or how we can reflect as a team. And I look forward just sharing on the wards, in the clinic, with the team, what can we do differently? Is there something we can take in or encourage others to kind of develop further?
Oh, perfect. So that was one reason. What was the second one?
Oh, I thought the first one was presenting 2 different. So, and if I would add another one, that would be probably exciting, looking forward to meet friends and to kind of learn more myself. Where do we develop? How do I develop further?
Okay, perfect. Thank you. There's also another reason why you're here.
Yes, that's true.
There's 3, let's be honest here,
actually,
Andreas.
yes.
He's being shy. You have a presentation that hasn't happened yet at time of recording, but you're going to be giving a presentation later this afternoon. Now, I think you have, 5 minutes to do it?
I think it's 6 minutes, but we'll see how that goes.
Okay. So they're being nice and giving you 6 minutes. I'm going to give you 1 minute. Tell us what you're presenting. 1 minute.
For me, it's an exciting clinical case with a heart failure patient where it's like these subtle red flags with amyloidosis, which makes us think. And I think everyone has a role in recognizing them and to keep an eye on it. And I'm trying to highlight that for the patient with AL amyloidosis. Like a crucial thing is that we recognize it early. And everyone, independent of where you are, cardiology, surgery, geriatrics, plays a big role.
Yeah.
And there's so much to learn. I'm trying to get it across. Thank you.
Oh, perfect. Thank you. I'm looking forward to it later this afternoon. Last and most important question. Why should nurses and allied health professionals come to this Congress?
Well, I think I've been here now the third time, and I just love the vibe. I love it that you, independent of what role you do back home, you can talk to people, just approach them. You can connect, you can learn. There is topics for everyone in the cardiovascular area, and mentoring, like how to develop. I think there's so much more. A question would be, is why not? And
I love it.
And if you think, how can I participate? Just bring, like I did, a clinical case.
Yeah, it's a great way.
Something we can bring in, and it connects beautifully with the abstracts of others, so it brings a practical insight. So please, just give it a go.
Thank you so much, Andreas, and thank you for sharing about your experience. And I hope you enjoy the rest of the Congress.
I hope you too. It was great seeing you, spending time.
Next, I have with me the very amazing Robyn Gallagher from Australia. Robyn, can you introduce yourself and tell everybody who you are, where you're from? Well, I kind of gave the first two away, didn't I? What you do.
Well, hi, I'm Robyn Gallagher. I'm a professor of nursing from Sydney, Australia, and I work in cardiac rehab and secondary prevention.
Oh, perfect. Thank you. So we're here at ACNAP. I've managed to steal 5 minutes of your time. Thank you very, very much for being a willing participant, or should I say victim?
I'm going for victim.
Okay, fair enough.
All the same.
So you're here at ACNAP. Can you tell us a little bit about what you're here doing?
Okay, so I love coming to ACNAP as a starting point. I feel it's got really good research, and I feel there's a genuine interest in helping clinicians and early researchers to develop their work. So that's the ethos. This particular time I'm coming because I've been invited to speak on cognitive impairment in cardiac patients, an under-researched and under-investigated and supported area. And I'm also talking about evidence for digital health. And the reason I was chosen is because I do a lot of digital health in Australia because of it's such a big country, it's very hard to get health services outside of cities.
I absolutely love both of your talks. Particularly, I think for me, your talk on cognition really struck a note in me because you really presented a very focused section on how it affects not just men with heart failure, but how it, particularly the complexities around females with heart failure and cognition. So I really, really enjoyed that talk.
Okay, so that talk went a bit beyond heart failure. So it went to the surprise group. The known group is heart failure and atrial fibrillation and congenital heart disease. The unknown group is people with coronary heart disease. So that's an area that I've increasingly focused on. And it's very evident that there's mild cognitive impairment in a lot of patients during hospital and persisting post-hospital that we don't take account of when we're providing secondary prevention and patient education. But the surprise group to me were the SCAD group. And the impact on people's lives of what we call brain fog in that group is really shocking to me. Young women, younger women, primarily, trying to manage their lives in a context of really low information for them on how they can do it. And they're struggling and they're thinking about stopping work and when they can, whether they're any good at their jobs anymore. So it really is difficult for them.
Yeah, no, it was so interesting, your talk, because I think
at the beginning, before I started my PhD, I wanted to focus in on cognition within heart failure, because I was seeing in my patients, compared to any other group of long-term condition patients that I worked with, that they really seemed to hold on to the information. So I would spend a lot of time teaching them about their condition, about how to manage themselves, and then you'd see them in 2 weeks' time and they'd be like, what? It just had gone. And so I think it's still something that's close to my heart, even though for my PhD I went a broader scope. And so it was really good to be hearing about that. So is that now your current focus within your own research in Australia, or are there other strings to your bow?
Yeah, so not entirely, but patient education and challenges and hidden barriers are. So we really focus on supporting people understand their condition enough. They don't have to be experts, so that they can action the behaviours that might save them from having recurrence or their disease progressing more. So the area that I'm working on is largely around cardiac rehab. Cardiac rehab's demonstrated high quality evidence.
Yeah.
It works, but only 30% of patients internationally attend it. So we've got to ask ourselves why, and I investigate that area.
Oh, okay.
But one of the areas, some of those things can't be changed. And this is when I discovered health services research in cardiac rehab. I kept thinking, why can't we just change cardiac rehab? Why don't we run it at different times of the day?
Yeah.
Why don't we deliver it hybrid?
Yeah.
So that's when I came across that it's very difficult for health services to change, and it's perhaps more difficult for providers who get a lot of job satisfaction to change the way they do things. So at the moment, I'm doing a type 2 hybrid effectiveness study, which is classic implementation science, on 43 cardiac rehab programs across our two biggest states, New South Wales and Victoria. And we are working with half of those people, those programs, to understand what's happening with their patients, their processes, and work with them. So every month we facilitate a discussion about how the quality of their program and their patient outcomes, and what small changes they can make to improve those. And then we get together every couple of months and have a workshop all together. So it's basically a collaborative.
Very cool.
Yeah, so that trial intervention phase, because it's hybrid effectiveness, it's all in. And we finish in August.
Ooh, so
Yeah.
exciting times ahead.
Yeah.
So definitely, if you don't already, you need to make sure, if you're listening to this, if you're finding what Robyn has to say interesting, make sure you follow her on social media, because she's pretty active there. So you'll be able to get updates after August when you can tell us how it all went.
Well, certainly we're going to do a process evaluation. It's a really important part of it, because the process evaluation is going to help us understand how people interact, how people perceive the intervention. Because it's clear to us that there is a warm-up phase where people get used to looking at their own data and used to thinking about their program. So it takes a while.
Fascinating. I don't want to take more of your time, because you have been like a little busy bee around the conference today, having lots of conversations with people like me who look to you as inspiration. I have one more question before we wrap it up. For anybody out there who may not yet be doing research within their clinical career, whether that's as a nurse, a physio, an OT, whatever they do within clinical services, why should somebody follow in your footsteps and embed research into their clinical practice?
I think it's because it actually makes you feel empowered. It's about thinking to yourself, I can make a difference. I can understand what's happening when my clinical service, or I feel like things aren't going right. You can do research, you can be curious about that, and you can do it in a neutral way that's not judgmental about your own work. You can feel good about yourself, and you can think, I can do something. I can understand what's happening, and I might just be able to make a small change that would make a difference.
Oh my word, I literally got goosebumps listening to that. That's so lovely. Thank you so much for your time, Robyn, and thanks for being a willing victim.
Oh, it's a pleasure. I love talking.
Perfect. Thank you.